Looking Forward Our Way podcast addresses today's critical issues affecting adults in Ohio. We focus on issues that affect our money and our neighborhoods. Our expert guests are here to provide the information and resources needed to address those challenges. We are looking forward our way. Hi, this is Brett. Our national population of older adults is growing rapidly, but here in Ohio, Delaware County is growing in every age category. The county has a median age of just under 40, while the population of those 65 and above doubled between 2010 and 2022. With 40,000 individuals over the age of 65, 16% of the county's population of 238,000, Delaware County has a challenge to provide needed services for every group from K-12 to elders. With us today is Farrah Waugh, Chief Executive Officer of SourcePoint, where Delaware County's older adults are thriving. Thanks so much for joining us today.
Thank you. Hello. I appreciate you having me.
Great.
It's so good to see you, Farrah. Our paths have crossed a lot over the years. SourcePoint was a great partner with Employment for Seniors, and I was always up there talking to people, and they would usually look at me like, what? What? A job? No, because they were having way too much fun at SourcePoint, needless to say. Yeah. So, but we wanted to have an opportunity to talk about your services because this is a little different than the folks in Franklin County are used to hearing about. So thank you again for your time.
Thank you.
Before we really get into your expertise into this podcast regarding all of these issues, you've been at SourcePoint for over 30 years.
Yes.
And with your background in social work and mental health counseling, you really have a handle on what the issues are. Tell us more about that journey you took to SourcePoint and sort of what kept you in this career field all these years.
Well, thank you, Carol. It's really a pleasure to be here. I started my career in social work, in mental health, as you mentioned, but it was early in my career that I recognized the importance of supporting older adults. I worked first with at the hospital setting, and then I went to the Alzheimer's Association, and it was there. And it was really a joy. Just being with the older adults was a joy of mine, and that has remained to this day. But knowing that they need the kind of support that supporting older adults as they age is very important, and especially as it becomes more complex. What's kept me here for 30 years, I love the job, I love the people that I work with, of course, but it's really the impact that we have at SourcePoint on the lives of the older adults that we serve. Every day we're helping people stay independent, stay connected, and live life to the fullest on their own terms. And I actually get to witness that each day. And it's really incredible, meaningful work. And I feel very fortunate.
You know, I wonder if that does happen in services for older adults, because we used to say the same thing at Employment for Seniors with all of our volunteers who would go in and talk to clients. Every day they knew they made a difference in somebody's life. And you don't always see that when you're working in government or nonprofit. You're too distant from the individual that you're helping.
That's very true. And it's true even when I worked in the hospital setting. You know, you were oftentimes seeing folks at their most vulnerable and not necessarily in the best circumstances. And we see the whole spectrum at SourcePoint from healthy and vigorous to those that are needing more support. But you get to see everybody doing it the way they want to do it.
Very true.
Nice. Very true. Well, each of us has our own idea of what an older adult needs, and we are likely wrong. There are many issues that our older relatives and friends face each day, such as health conditions. What do you see as the major challenges your clients tackle daily?
Well, the needs are broad, and they're as varied as the individuals that we serve, but they're also often layered. And so many older adults are managing chronic health conditions while also trying to keep up with the cost of housing, food, prescriptions, and transportation, all on a fixed income. Access to affordable and accessible housing is a growing concern, especially when someone wants to remain in their home, but the home itself no longer fits their mobility needs. So that becomes a challenge. We also see, especially during the pandemic and since that time, social isolation. And that's become huge with all ages, but particularly with older adults. There's caregiver stress and the emotional toll also that comes along with loss, changing health, or cognitive decline. And increasingly, this is a little bit on a lighter note, but increasingly there's also a digital divide with older adults. And technology now, as we all know, affects every part of our life, from scheduling medical appointments to using telehealth and managing benefits, as well as staying connected with family. All of that requires technology. If older adults don't have access to devices or internet service, or they lack the confidence or skills needed to use that technology, it can directly affect their health, independence, and the quality of life that they have.
Yeah, I just saw something post up on LinkedIn that the Columbus Metropolitan Club just had a topic, and as we were recording this in April, so they always have those online so you can go and see it, but the topic was of older adult homelessness.
Yes.
Which I had to comment going, it's mind-boggling that we even have to put all those words together and that it exists.
Yes.
It's mind-boggling. You should not have to worry about that.
Yes.
As you progressively go through life.
After you've paid for housing for
and
40, 50, 60 years.
Paid for taxes, paid for services, there's just ultimately there's no reason for it.
Yeah.
I mean, it ranks right up there with any support for veterans. That you've gone through what you've gone through.
And for children.
It's ridiculous.
I mean, we have, Delaware's young K through 12 population is just growing rapidly, but there are as many older adults who need help as children K through 12.
Yes, right. That's very true.
The other thing too, and one of the things that I was excited that we're going to get to talk about is that SourcePoint really does have that huge, broad spectrum of services. So you've got the person who is learning music, learning art, doing crafts, to the caregiver taking care of the person who is potentially bedridden, as you said, the chronic diseases. And all of those pieces are so important. I'm coming from the issue of caregiving too, because I did that. And that's actually how I started learning about services for older adults, because at the time when I was taking care of my parents, which has been over 20 years ago now, unless you qualified financially, you couldn't even get information. That's what I was appalled. I'm like, I'm not asking for you to do anything. I'm not asking for you to give me money. I'm just asking you, what do I do? Who do I call? Where are these services that I can use or can pay for? And nobody could answer that. And Tony Carroll, who was just an incredibly delightful, wonderful person from Franklin County, AG, and I had a lot of conversations about that people needed the information.
Yep.
Whether they qualified or not.
They do. Yeah. See, connecting with that information is the starting point.
Absolutely.
Really.
Absolutely.
And many people don't make that initial contact until they're in crisis.
Exactly.
Yeah.
Which is really what happened with me, because my mom died and she was my dad's caregiver. So I became his caregiver, and at the point in time in which I had left her in the emergency room, we didn't even know what medication he had taken that day. So I had to get in touch with a doctor on the phone and explain all of the medication, and we had to guess what to give him that night before he went to sleep.
Oh, wow.
I mean, it really is
scary.
It is very scary, and caregivers, thank goodness, we're starting to pay attention to their issues and needs. So that my commentary for the moment. So as I was saying, the services are incredible and very wide across the spectrum at SourcePoint. 3 major services, as I mentioned, in-home care, community programs, your directory of resources. Those are, I just sort of encapsulated your all of that you do into those 3 areas. Let's first hear about the in-home care services, and are they likely the most critical to a person's daily needs?
Our in-home care services, which is really our flagship program, in-home care, it's truly at the heart of helping people age in community, and that's what they want to do. They want to age in their own homes, age in the community that they live in. For some, that starts with the caring and professional services of a licensed social worker who works with the older individual and sometimes their caregivers, as you were talking about, Carol, to determine their needs and develop and coordinate a person-centered plan of care. This may start with setting up Meals on Wheels, which is much more than a meal. It not only provides the nutritional support that everyone needs, it also provides a regular safety check and offers a point of connection for someone who may otherwise be isolated. They may never see another person that day, but someone that brings in their meal and always has a friendly conversation with them and a smile. They always appreciate that, and our volunteers who deliver those meals appreciate that as well. Beyond the Meals on Wheels, our in-home care service plans can also include things like personal care, which is help with bathing and dressing and personal hygiene, homemaking services, which are light housekeeping duties, and medical transportation, emergency response systems, which are the buttons that are either worn on the wrist or around the neck, and other supports that help people remain safe at home. What's important about our in-home care services is that we do not look at people through just one need or a single lens. We actually look at the whole situation and help build the right combination of services so older adults can maintain their dignity, their independence, and stability. So I would say it's one of our, like I say, it's our flagship program, and it is a key to helping folks stay in their community.
Right. It seems like, and I may be wrong about this, transportation and no longer being able to drive is sometimes the first step in what could become a crisis when someone suddenly doesn't have that independence and may not have anybody that they can depend on for transportation. We did the Car Fit podcast several years ago, and it was more fun to talk about, but scary to think about because we'll all be in that spot at some point in time.
Yes.
But I would
Speak for yourself.
Okay.
What's the saying? You'll get those keys out of my cold hands.
Exactly. Yes. Well,
I only joke.
I have a wonderful cousin who turned 97 this year. Finally gave up her keys. Finally, and it was like, but she has an incredible group of nieces who. They divided up the issues and the areas. Medical one, grocery another, church another, and everybody has their responsibilities and making sure she gets where she needs to be. So
that's very fortunate that she has that kind of support.
Right, and they live near each other, which that's in Franklin County. In Delaware County, people are possibly more spread out.
Yes. Definitely. I know my parents live in Delaware County, and there's been times that they have not been able to drive. And I feel fortunate because I also live in Delaware County and am able to take them. But I know so many that aren't. And, if I weren't available, we do have a really great evolving transportation system in Delaware County, Delaware County Transit. They're a great partner that we work with.
They've gone through a lot of changes, but I think they're on the right track.
They really are. They're really expanding. They have grown in the number of trips that they provide, and we have a very strong partnership with them to provide transportation. But it's expensive to provide transportation. Transportation is costly. Yeah. And because of what you mentioned, people being spread out and maybe services not being close to to where they're living, it does make it to be a challenge for them.
Right.
Well, we've all been in a caregiving situation when finding resources was the first critical step. Can you give us more details on the various community programs provided by SourcePoint and that resources directory that Carol mentioned a little bit ago?
Yes. Our community programs are about connection, education, and prevention. We talked about the spectrum that we offer. We offer fitness and wellness classes, the creative arts that we were talking about earlier, caregiver support groups, and educational workshops. We also do Medicare and insurance guidance. We provide kind of counseling through making those kind of selections, choosing.
I will attest to the workshops that SourcePoint does on Medicare are the best.
Thank you very much. Yes. We have a great team of insurance specialists at SourcePoint, and they stay abreast. They also assist in connecting them with other benefits as well as
just learning
Medicare.
The language of Medicare was huge.
Yes, yeah. It's a difficult maze to navigate. And these programs matter, of course, because good aging is not only about responding to crisis, but it's also about maintaining physical health, cognitive health, social interaction, and a sense of purpose. That's very, very important. We do have our directory of community resources, but to supplement and enhance those community that resource book and directory that we have, our community resource navigators, they're a core part of what we do, and they help individuals and families navigate through that maze of resources and help them to hone in on what's important or needed by them and their loved one. It can be an overwhelming system, and it's volume. It has a volume of services that have to be navigated. So sometimes people don't even know where to start, as we talked about.
Right.
And that's where we can come in and where those community resource navigators can help them.
Are the navigators individuals working for SourcePoint?
Yes, they
are. So
are.
it's sort of like a call-in customer service type center.
Or a drop-in. We have people who drop in. We have people that call in or maybe make an appointment to come in. Our community resource navigators can help connect folks to the community resources, but also get them engaged with SourcePoint and learn more about what we have to offer and what might meet their needs through our programming as well. But we look at the entire community of resources and our partners, many of whom we partner with to provide services to the older adults in Delaware County.
That sounds like a fun job.
Yeah, I think it really is, and I think people really do appreciate them.
Oh, yeah. Talk to people on the phone all day? Yeah. I can do that.
You're more of a person-to-person, though. I think you'd want the drop-ins.
Oh, I could do that, too.
There you go. I see you doing the drop-ins.
I was going to say,
I'll let you know when next time we have a job opening.
I was just going to say, I think that would be fun. They say when a PhD is piled higher and deeper. I could talk to anybody about anything. But again, for listeners, if you're interested in working and being involved, organizations like SourcePoint are a great place that maybe you start as a volunteer, but who knows where that goes.
Oh, yeah. We have several employees that started as volunteers. We have several that started as student interns.
Yes.
And we're always, our Meals on Wheels program is really run by volunteers. I don't want to say it's managed by volunteers, but pretty much all of our meals are delivered by dedicated volunteers. They deliver the same day, the same route every week. And we're so grateful. We could not replace the volunteers and the services that they provide.
Compared to what Meals on Wheels costs compared to what it could cost.
Oh, yes.
If you didn't have a volunteer team.
Absolutely. Yes.
Oh, my
We
gosh.
have volunteers that help in the kitchen, too. We have volunteers that do everything.
You do not want me in the kitchen. I will promise you that. That's not going to happen. I'm probably the only Italian in town that can't cook.
I didn't know that was possible.
I know. Neither did I, but it is. It's absolutely. I always said it was a good thing I'm not a picky eater because I'd starve to death. Members of our audience are likely to be familiar with the levies. Not every county has a levy, but those in areas that do have a county levy that provide services to older adults, folks know about it. Franklin is the largest in central Ohio. Delaware also has a very large funding base. But before we get into the actual funding details, can you provide us a little bit of an overview on the funding streams? People they hear levy, they hear the Older Americans Act, they hear federal money, they hear state aging services. It's confusing.
Yes. Well, aging services is a mix of local, federal, and private support. At the federal level, the Older Americans Act provides funding for services like Meals on Wheels, caregiver support, some transportation, and other community-based supports. In Ohio, those dollars flow through the Ohio Department of Aging and area agencies on aging before reaching local providers like SourcePoint. The state plays more of an administrative and coordinating role, and there are a few state-supported aging initiatives where funding is connected with certain services. But for SourcePoint, the most significant and reliable support comes from local levy funding. That local investment is what allows us to respond to the needs that we see in Delaware County. Federal funding is important, but it doesn't come close to keeping pace with the full demand for services and certainly doesn't keep pace with the true cost of providing those services.
Right. It's Employment for Seniors was a very small, very simplistic model of an agency, and I was amazed at the complexity of funding out there. Mm-hmm. And we were only in one little tiny section, and I've been to meetings at Central Ohio Area Agency on Aging, and the nomenclature of issues and funding streams and the limitations on those dollars is amazing.
Yes.
It's not
a
easy.
lot of restrictions that go along with,
right,
particularly with federal dollars.
Right.
Yeah. So the Delaware County Senior Services Levy provides a large funding base. It's administered through SourcePoint, which is a nonprofit as opposed to a governmental office. Often the funds just pass through. So how is the structure advantageous for Delaware County, and what happens in a county when no levy dollars are collected?
One advantage of Delaware County's structure is flexibility. Because SourcePoint is a nonprofit organization focused solely on aging services, we can be responsive, innovative, and deeply specialized. We don't have quite the same restrictions that, as I mentioned, the federal funds would place on us. We can braid together levy dollars, grants, donations, service fees, and volunteer support. As I mentioned, that's a huge factor to build a more comprehensive system than any single funding source could provide by itself. It also helps that decisions stay close in the community. Mm-hmm. We can design services around local needs rather than using a one-size-fits-all model. In counties without levy dollars, services are often, if not always, limited, very limited, and depend heavily on federal and what little state funding is available, which usually, as I mentioned before, it's usually not enough to meet the needs, even in some of the smaller counties that don't have those levies. And that can mean fewer services. It can mean long waiting lists, or less capacity to help people before they reach a crisis point, which is much more costly in even in funding that comes from from the state and federal government under Medicaid. So that's a more costly alternative if you wait until the crisis hits.
When I was on the advisory council with COAAA, that was one of the things that I quickly found from hearing from individuals from the different counties and different agencies is not having the waiting list, particularly when COVID hit. Because suddenly it wasn't just a senior who couldn't go grocery shopping. Nobody could go grocery shop. I mean, we were at a crisis. And because there was some flexibility in funding and some additional dollars coming in for those counties in need that already had long waiting lists, people literally could have starved to death.
Yes.
It was pretty awful. COVID. We've said this, because it seems like no matter what the topic is of our podcast, COVID always is a topic. But one of the things that we have said in other episodes, COVID didn't just bring out a crisis. It let us look at the crisis, look at the issues in a different light.
Yes.
So we now look at the digital divide not just as somebody who can't figure out how to use a remote control, but how can a technology make that person safer in their home?
That's exactly right.
And it really brought up a lot of things that we probably would not have ever seen or not dealt with for a long time. Not that I'm saying that COVID was a good idea by any stretch
Right.
of the imagination, but yeah. So
yeah.
Do you see the other counties who don't have levies getting levies soon?
Well, most counties in Ohio do have some sort of levy. They all operate differently. Ours operates similarly to Franklin County's levy, but I guess it kind of depends on what happens both legislatively and in future elections. I know that there's a lot of focus on property tax levies,
Right.
particularly. Not all senior services levies, though, are property tax levies. Some are income tax. But as I know, many of us have concerns if those property taxes are eliminated, as is being discussed, if those property taxes are eliminated, then that money has to be made up in some way, and that'll be more likely higher sales tax, which always hits those with lower incomes harder than it does with higher incomes. So I think it's a great opportunity, and I know we see our neighboring state, Michigan. Not all states have this as an option either, and we see our neighboring state, Michigan, has actually begun to go for property tax levies to fund senior services as well.
Okay.
Yes, I was speaking with some colleagues at a aging conference last week, and they shared how many more counties are putting ballots or putting levies on the ballot.
Interesting.
Yeah.
Is SourcePoint's levy considered a property tax?
It is.
So that is huge.
Yes, very much so. The levy supports many of the services that help people maintain and remain independent and avoid more costly care, which we talked about. I mean, that really is one of the biggest factors in having a levy-funded program. And it includes the Meals on Wheels, because the federal funding that we receive for our Meals on Wheels program is about a third of the actual cost of the meal. And as you mentioned, the costs would be more significant if we didn't have the support of our volunteers as well. It also supports the transportation to medical appointments that we provide and the care coordination that our licensed social workers provide, respite, personal care, and a range of supports for family caregivers. So it's critical. The levy funding in Delaware County actually fills the gaps that other funding sources do not fully cover. And between 75 and 80% of our overall funding comes from that local levy. And 77% of our expenses actually goes directly to programs and services that support older adults. So the local support also helps make it possible to offer programs at reduced cost and to respond when federal funding doesn't cover the full cost, or as what has occurred twice now this year, it helps to helps us to provide the services even during delayed reimbursement, which is what occurs under federal government shutdown.
Mm-hmm.
Yeah.
You know, it's I understand why people are frustrated, but I hope that before you go to the ballot box, you really do your homework and see what will be missing, because the group that is behind getting rid of the county property taxes have come right out and said it's not their problem to figure out where the money will come from.
Right.
And which I think is unconscionable. But again, I understand their frustration because things could have been dealt with a long time ago that the legislatures didn't do. But I guess I just want to encourage folks to please be sure you know what you're voting for or against.
Yes.
Before you walk into the ballot box.
Yes.
Yeah,
and don't sign a petition unless you know what you're saying.
Exactly. Exactly.
Well, and again, it sounds like we're against it, but it's one of those. But it's be educated before you do. Maybe it is something that you truly don't want, but also know what the domino effect is of where it goes away. And we had a really good episode with Franklin County auditor Michael Stenziano, and that's a good one to listen to as well, to understand how to even read what the property tax looks like, and so you're not overtaxed or that sort of thing. But
yes,
this is a much more complex issue than just saying you want to get rid of it. You need to look at it a little bit deeper. And again, it could be the right thing. That's not ours to say. It's ours for this platform is to do your homework.
Right.
Exactly.
Do your homework. Yeah. And see what happens.
Yeah. It's
Yeah. So are there any new programs or services coming to SourcePoint that you want to talk about?
Well, it probably won't surprise you that one of the areas we're focused on is improving digital access to older adults. Technology, again, is part of healthcare, communication, financial safety, and everyday independence today. We want to continue helping older adults build confidence in using their devices, accessing the internet, telehealth, online forums, all of those things, and the tools that allow them to stay informed and connected. More broadly, our future work is about keeping pace with growth in Delaware County, while preserving the personal, community-based approach that defines SourcePoint. As the population grows, we want to continue strengthening in-home care services, caregiver support, opportunities for social connection, and practical resources that help people thrive after 55.
So, Farah, we always allow or ask our guests to give us some last words of wisdom. Tell us about what you want to make sure our listeners hear.
Well, first and foremost, call SourcePoint or visit us on the internet, visit our website. But I would also simply encourage listeners to think about aging differently. Aging is not someone else's issue. It's a family issue, a community issue, and if we're fortunate, a future all of us will share. And the best time to learn about resources, make plans, and build supportive communities is before there is a crisis. I would also say this: older adults bring tremendous value to our communities. And when we invest in helping people remain healthy, connected, and independent, we're not only supporting individuals, we are strengthening families and our communities.
Thanks to our expert guest, Farah Waugh, Chief Executive Officer of SourcePoint in Delaware County, Ohio, where those 55 plus thrive.
The views and opinions expressed by the experts interviewed on this podcast are their own and don't necessarily reflect the views of the podcast hosts or any affiliated organizations. The information provided in these interviews is for general informational purposes only and should not be considered as professional advice. Listeners are encouraged to consult with qualified professionals for specific advice or information related to their individual circumstances. The podcast host and producers don't endorse or guarantee the accuracy, completeness, or reliability of any information provided by the experts interviewed. Listener discretion is advised.